What are the top 5 call types that give rise to lawsuits? The number one thing that gives rise to lawsuits is still medical negligence. It's still bad patient care. That is by far the primary thing that gives rise to lawsuits. The second thing is lights and sirens involved motor vehicle accidents, which is a huge reason to reduce overall in response and in transport the number of lights and sirens responses we do. It's better for the patient, it's better for us, and it happens to be better legally. The number 3 thing that gives rise to lawsuits is dropping patients, is lifting and moving problems. And there's almost no excuse for that one. That one, at the end of the day, if you use proper technique, you have good policies, you establish good procedures, you have help, there's very little reason to drop patients. Number 4 are calls where no patient was found, but there actually was a patient. Because when we miss calls where there's actually a patient, they're usually sick, and that bad outcome, lots of lawsuits come from those. So whenever you have a no patient call, you have to show the reasonable efforts you took to find that patient. Number 5 is patient refusals, less than no patient calls, but still patients not going to the hospital, not receiving care when it's necessary, especially when EMS providers talk patients out of going to the hospital. Those have bad outcomes.